Clinical Dermatology and Dermatitis. ISSN 2631-6714. An open-label, single-arm, monocentric study to evaluate the efficacy of a test product in hair fall reduction and scalp nourishment in healthy Indian female subjects. Open Access Journal. Clinical Dermatology and Dermatitis. An open-label, single-arm, monocentric study to evaluate the efficacy of a test product in hair fall reduction and scalp nourishment in healthy Indian female subjects. Mohan Chavan, Associate General Manager R&D, Kaya Limited, and Hari East, Mumbai, India. Sangeeta Vilaskar, Vice President and Head, Medical Services and R&D, Kaya Limited, and Hari East, Mumbai, India. Kajlar Aura R&D Executive, Kaya Limited, and Hari East, Mumbai, India. Saley Mendley. Article information. DOI 10.31021/CDD.201811102. Article type, Research article. Journal type, Open access. Volume 1 Issue 1. Manuscript ID, CDD1102. Publisher, Boffin Access Limited. Received date, March 1, 2018. Accepted date, March 5, 2018. Published date, May 12, 2018. Corresponding author. Mohan Chavan, Associate General Manager R&D, Kaya Limited. And Hari East, Mumbai, India. Email, mohan@kayaindia.net. Citation, Chavan M., Vilaskar, Aurora K., Mendley S. An open-label, single-arm, monocentric study to evaluate the efficacy of a test product in hair fall reduction and scalp nourishment in healthy Indian female subjects. Clean Dermatititis. 2018 May 11, 102. Copyright 2018 Chavan M., et al. This is an open access article distributed under the terms of the Creative Commons Attribution 4.0 International License, which permits unrestricted use, distribution and reproduction in any medium, provided the original author and source are credited. Abstract. The study involved the use of cosmeceuticals for the hair fall reduction and improvement in hair strength and scalp condition in healthy Indian female subjects. The use of these cosmeceuticals as anti-hair fall agents prevents hair damage, nourishes and conditions the hair, reduces breakage, and soothes the scalp. The present trend of using marketed anti-hair fall agents has many side effects and there may be a chance of causing further damage to the hair. In order to overcome their side effects and to have maximum therapeutic efficacy, present study was aimed to evaluate the treatment for the hair fall with the cosmeceuticals. Methods. An open-label, monocentric, single-arm study was used to evaluate hair fall reduction and scalp nourishment. The natural olive oil along with other excipients like macadamia and avocado oil and basil extract was formulated and the study was conducted in 35 numbers of healthy female subjects aged between 25-55 years for a period of approximately 90 days, that is, 3 months for each subject, which included a total of 3 visits. Parameters. Screening, dermatological evaluation, instrumental evaluations and subject self-assessment were used to evaluate the anti-hair fall and scalp nourishment properties of the test product. Results and discussion. Improvement was seen in majority of parameters, starting from 30-90 days. The product was safe and well tolerated as per the dermatologist and subject's self-assessment. Keywords. Cosmeceuticals, hair oil, macadamia, monocentric, hair loss, hair fall, scalp nourishment. Introduction. Hair loss is one of the most common problems seen in both men and women. Some experiences less hair fall while it is acute with others. The underlying reason can be genetic or due to the influence of environmental factors. It can be diagnosed by conducting tests on hormone levels in females, serum iron levels, and scalp biopsy, etc., to examine the root cause of the hair fall. 1,2. In general, hair fall is seen due to nutrition deficiency, autoimmune disorders, or it may be due to environmental causes. 3. The two most common types of hair loss are androgenetic alopecia, male or female pattern baldness, and alopecia areata, AA, an autoimmune condition that causes patchy hair loss that is a single bald patch or extensive hair loss in patches. Telogen effluvium is one type of temporary hair loss that appears as a thinning of hair on the scalp. Hair loss can be triggered in many different ways, which include severe stress, sudden change in hormone levels, iron deficiency, environment, physical or emotional trauma, diet, and some medications. The best way to treat TAE is to figure what is causing the hair loss and also change of lifestyle and diet. Another type of hair loss is due to alopecia areata, that affects patches on the scalp. AA is an autoimmune disease in which the immune system attacks the hair follicles, mistaking them for pathogens such as viruses. AA can be treated by injecting steroids in the affected areas. Although hair fall is treated by using various drugs and anti-hair fall agents, they have many side effects, and one cannot conclude it by saying the problem can be cured without its recurrence. So in order to treat hair fall with minimized side effects, the concept of cosmeceuticals came into existence, which is used as a novel approach in the present study. History. Among other parameters which are taken into consideration for the diagnosis and treatment of hair fall, medical and personal history of the concerned person who is facing the problem is taken as the important attribute. 4. The information which is collected from the concerned person should include the signs and symptoms of hair loss, such as loss of hair from certain parts of the scalp, loss of hair after great illness or stress, loss of hair after drug treatment, loss of hair due to immune diseases and disorders, history related to hair loss that runs in the family, and also the history of psychological distress. This information must be noted by the patient. Based on this information, further treatment methods and methodology for the patient is planned. 5,6. Physical examination. After taking the detailed information from the patient, the doctor examines the patient thoroughly. The first thing to be checked out is the skin type of scalp. The scalp color, distribution, and presence of the hair follicles should be noted. The pull test and the comb test is performed in order to assess the hair shedding level. 7-10. These simple tests can show degree of the hair loss. The pull test is carried out in a way that physician grab 25-35 hairs with their fingers and try to pull apart gently. If in case 10 hairs remain in her hand, it indicates a sign of major hair loss. One hair is taken as sample for the microscopic analysis, and the analysis was performed by using instruments like genodermatoses, which is a light microscopy of the hair. The tensile strength of the hair should also be noted. Leaning over a light-colored bed sheet, comb from the back of the top of the head forward to the front of the scalp for 1 minute. Seeing about 10 hair loss indicates abnormality. Although there are many methods and a lot of drugs that are used in the treatment of HF, they have many adverse effects, so to avoid that, the present study was aimed to evaluate the treatment of HF and reduction and scalp nourishment by using a novel approach of cosmeceuticals. 11,12. Cosmeceutical products are marketed as cosmetics, but reputedly contain biologically active ingredients and show their efficacy by minimizing the side effects and produce the maximum therapeutic benefits. The test product was formulated by using the active pharmaceutical ingredient natural olive oil along with other excipients like macadamia and avocado oil and basil extract. Materials and methods. Study design. This was an open-label, single-arm, monocentric study, included 35 healthy female subjects aged between 25-55 years and was conducted for a period of approximately 90 days, that is, 3 months for each subject, which included a total of 3 visits, and tested for the Signs of scalp hair getting thin or complete hair loss after great illness or stress, thinning of hair, slowly loss of hair from the top. And other anti-HF products, 13,14. Any history of underlying uncontrolled medical illness including diabetes mellitus, hypertension, HIV, hepatitis, severe anemia, serious disorders of the heart and respiratory apparatus or any other serious medical illness was noted. The study included 3 following visits. Visit 1, Day 0, comprised of screening, enrollment, dermatological, instrumental, subject self-assessment and habit questionnaire for all subjects. Comb test was also a part of the screening test. Visit 2, Day 30, follow-up evaluation. Visit 3, Day 90, follow-up evaluation. The subjects were selected based upon the selection criteria, inclusion criteria, exclusion criteria. Critical selection criteria. I. Female subjects in general good health, see exclusion criteria. 2. Subjects in the age group 25-55 years, both the ages inclusive. 3. Subjects having a hair fall concern, seen with more than 30 hairs in the comb test. Inclusion criteria. I. Female subjects in general good health. 2. Subjects in the age group 25-55 years, both the ages inclusive. 3. Subjects willing to give a written informed consent and agree to come for a regular follow-up visit. 4. Subjects having hair fall concerns seen with more than 30 hairs in the comb test. V. Subjects willing to abide by and comply with the study protocol. Vi. Subjects who have not participated in a similar investigation in the past 3 months. 7. Subjects complaining of hair fall and damage. 8. Healthy volunteers with no known allergy as established by medical history. 9. Subjects who do not smoke or drink. X. Subjects who are not crash dieting. 11. Subjects willing to refrain from any type of hair treatment like perming, straightening etc. during the study duration. 12. Negative UPT test for subjects. Exclusion criteria. I. Subjects having any active scalp disease which may interfere in the study, dermatologist's judgment. 2. Subjects who have taken chemotherapy for cancer in the 6 months prior to start of the study or have a plan to do treatments during the study. 3. Subjects who have a history of alcoholism and/or psychiatric disorder including trichotillomania. 4. Subjects who have had a hair transplant. V. Subjects who take a pharmaceutical product which cause hirsutism, X. Phenytoin, and finasteride for androgenic alopecia.